I'm Connie Stover. I'm 67 years old, and I'm a registered nurse. I've had 2 knee replacement surgeries. Both of them were done at Provena Mercy with a stay at McCauley afterwards. 5 years ago, I had my right knee replaced. Before the surgery, actually, I decided to come to McCauley after the surgery, right from the hospital, knowing what McCauley had to offer. When I first told my children 5 years ago that I had planned on going to McCauley from Mercy Center, they were horrified. They said, "Mama, you don't need that. We can help you. We can take care of you." But I explained to them that in the long run, this was better for me. I was really doing this for me and for what I could receive here. And for the couple weeks out of my life, how much better I was going to be in the long run. Until they saw what there was here and saw what was being done for me. And then they were so impressed. And I can't tell you how many times they told people afterwards, "Now I understand why she made that decision." This is 5 years later. This is my second knee replacement. Since then, I had retired to South Carolina. But in talking with my children and knowing what a good result I got, I decided to come up here for the surgery and then come to McCauley. This time was even better. McCauley has its own full-time nurses, and they have the same areas that they take care of, and they know their patients, and you see familiar faces day after day. The pain management, as a nurse, I really appreciate that. I can mention to anybody that comes into my room, whether it's housekeeping, an aide, or the nurse, that I'm having pain. They immediately put a note on the nurse's cart. She sees that and she brings my pain med so that I get it in time. And that, of course, means that it works better because I don't get into really bad pain. The teamwork of the staff is much improved. They really have patterned my physical therapy for me, for my needs, what I'm going home to, and how I live. Between the physical therapy and the occupational therapy, I get 1.5 hours in the morning, 1 hour in the afternoon. And that would be as compared to have someone coming to my home 3 hours a week, 3 times a week. It's just, you just can't compare. The occupational therapy is going to include Skype this afternoon in my occupational therapy so that I can talk to my grandson who's in the Air Force in Alaska. People think that only if you live alone would you have to come to a skilled nursing facility. Even if you have a spouse at home, you're not going to make the same progress. You're not going to have the best results. And it's very important to me that I get good care and good rehab because I live alone, and I want to continue to be able to do that.